take on board, we need to embrace and really see the changes that come forward. These are pioneers. Who are pioneers? People who have set the path, people who have cleared the forest, and people who really set the bar for everyone else to rise up to. That's who we're talking to today, or I hope they feel that way, because it is very, very important to have that on board. There's so many different challenges in dentistry. Having these sort of challenges in dentistry is equally important. Having the support is important. And so I'm really pleased to welcome Emer O'Connell as tonight's host, hosting a session of Amplifying the Female Voice in Implant Dentistry. Welcome to Tubules Live, beaming from, well, it's not the Tubule studio, it's beaming from our homes, and it is all about all of us sharing knowledge and inspiring each other. That's why we are here at Tubules each week, inspiring, energizing, and filling everybody with enthusiasm. Before I introduce the host and the panel, I always give you a short introduction about Tubules, and I always talk about a few questions or something to think about, really. So today's Let's Get Going as well. Every Monday, every Thursday, 7:30, we start and end your week with inspiration, positivity, and enthusiasm. And this evening's Tubules Live is in association with the ADI. All ADI members, if you're a member of ADI, you get dentinal tubules included in your membership. That's double the power, double the resource, double the learning, double the connectivity. That's what you should all be doing, joining the ADI and getting tubules with it. Welcome to the growth engine. Get your wine glasses ready, get your gin, get whatever it is, or your glass of water, whichever thing you're doing to listen to it. Let's start with a thought, really. I ask you a few questions. Do you want to be a good dentist? Perhaps today's question should be, do you want to be a good implant dentist? Do you want to be the best that you can be in whichever field you work in dentistry? Today's question will be, do you want to be the best implant dentist that you can be, no matter who you are, where you are, or what you do? And do you want to be successful at what you do, whatever your version of success is? Why do you learn? This question always comes. You go to learning congresses, courses, webinars, everything. Why do you learn? Success does not happen by accident. I always say success happens because of some pillars of growth. You know what? The first thing I always tell people, know your goal. What are the goals you want to go for? What do you want to aim for? Because today's panel will tell you some of the goals. What did they aim for? What was their journey? And your goals are always related to whatever your need, your desire, your wish, your aim is. And somewhere there lies your definition of success. But the second thing is to figure out how to get from where you are, to cross that bridge, to get to your goal. And for that, you need to be making a plan. You need to be thinking about this plan. You need to be working out what's your growth going to be to get past this plan. And growth happens because of 5 pillars. A clear definition of your goal or definition of your goals, getting the right knowledge and skill, having the right environment where you can really perform to your best. And the most important is the 5th one, having the right community, network, tribe, or people around you who inspire you, who support you, who give you feedback, and who are your crew, who take you towards your goals. And if you grow using these 5 pillars, and you follow that plan you've made using these 5 pillars, the chances are your growth will take you towards your goal. Your growth is something that will take you towards your goal and maximize your potential for success. And ultimately, we're going to hear some stories and tips today on that, really. And that's why you're here to learn, because through learning, you gain the knowledge, you gain the skill to help you get towards that. And Dental Tubules helps you by helping you find your inspiring goals, by helping you grow to achieve these goals using the 5 pillars I just described. We have the IPDP. We have over 2,000 online videos with, I would say, over 62,000 minutes of learning now. We have a courses section coming soon, and we do hands-on courses and partner with other courses and congresses. We work with over 400 practices now to create the right environment. And most importantly, we have 50 plus study clubs in the UK alone with 47,563 members around the world visiting dental tubules from 68 countries. This is what we have done to supercharge everybody's growth, towards their goals. And that's why we can maximize your potential to thrive towards your success. Inspire, grow, thrive. That's what Tubules is about. And if you're inspired and growing and thriving, that's when you lead your teams, especially if you're practice owners, managers. You need to inspire your teams to be growing in the same direction. Because if we grow together, we embrace the 5 pillars of growth for our practices too. Inspire, grow, thrive together and achieve whatever your goals are. That's what Tubules is about. Yes, we do CPD, ERMR, education, courses, core CPD, all of these things. But more than CPD, more than education, more than just webinars, our job is to inspire you and your team, to enable your team to grow so that together we can maximize our potential to thrive, to be the best we can be, achieve our goals. And not just professionally. Our growth is to help you on a personal growth level, professional level, and give you the financial knowledge to help you grow in that area as well. CPD as continuing professional development may be what others do. At Tubules, we aim to give you CPD as a complete person development. That's what we are. Our interest is you, the Tubulite. That's what we stand for. That's why we're an organization of 47,000 Tubulites who inspire, grow, and thrive each other together all the time. That's the growth engine, the V6 that powers you up. And what we like to do, students, undergraduate students worldwide get free premium membership on dental Tubules. In addition to that, ADI members, as I stated, get this Tubules premium membership, individual Tubules premium membership included in your ADI membership. If you still haven't taken advantage of this, where have you been? Take advantage of these things, because we put on a real show even this year. Personal development in January, a mixture of clinical topics in February. March was a prosthodontic month with all sorts of topics. April was all about digital dentistry, covering restorative implants and all sorts of elements. May was a mix of restorative dentistry, from temporaries to endodontics to endo, perio, prosto. And June has a variety of topics. And today is about amplifying the female voice in implant dentistry. And if you like what we do at Tubules, if you feel it makes a difference to you, share and spread the Tubules word. If you are Tubulites, share it right wherever you are, because the world needs Tubulitis. Yes, we have all these videos. Yes, we have all these study clubs. We do all of this, and we collaborate with organizations like the ADI to ensure that we serve dentistry. Now you make the decision. You can remain a sheep on an isolated farm, or you can join the tribe of Tubules tigers, making a positive difference in dentistry. And not just dentistry. We believe in making a positive difference around the world, which is why we commit 3% of the Tubules' gross annual turnover to the foundation so that we can build schools and facilities for children like these around the world. This was our first project, building a school library in Voi, and it started as a shell like this 2 years ago. The building has carried on with our 3% contribution, and the building is complete. In fact, we are now in the final phase of completing the internal aspects of this building, and nearly 1,700 students in the town in Voi, Kenya will have access to one of the best facilitated and best technology library they could ever have had in an area where they didn't have any education. That's the ethos with which Tubules works. And on that note, on that positive thing, we welcome you to this evening's event with Dr. Emma O'Connell hosting it, and a panel talking about amplifying the female voice in implant dentistry. It's an inspiring talk today. It's an inspiring panel. And this is a group of people who have taken pathways and roads that we would just dream to follow. So welcome. Now, how to get CPD for this evening, I will ask you to contact us. I'm not going to go over that because I'm far too excited to listen to this evening's show. So on that note, I will first welcome the host for this evening, Emer. How are you? Hold on, we'll ask you to, there we go.
I've unmuted myself.
Yes, we can hear you now. Thank you for arranging this and putting all this together with your team at ADI. I'm very excited to welcome you as this evening's host.
No problem. Thank you, Drew. Thank you so much for hosting us, and also for your collaboration with the ADI, which has been an amazing member benefit for all of our members. And as you say, there are ones of our membership that haven't taken advantage. So I encourage them to take it up as soon as possible. So thank you for all you do. And I look forward to chatting to my female friends here about their journeys into implant dentistry.
And thank you for all you did. 2 years of presidency at the ADI, in some of the toughest periods that we've seen in organizations. Amazing job. I have to ask you one question. You've had an amazing journey. You've done all this. Who or what inspires you?
Well, I think my grandmother actually inspired me a lot because, first of all, she had no teeth. And I woke up in bed beside her and realized she had no dentures in. So in fact, she was the reason that I became a dentist. And also my parents encouraged me to get educated. And obviously I love education. I've continued my education. I still love learning every day. It's a school day as far as I'm concerned. And I think that we don't place enough value on our education. And people like you, Drew, inspire me as well, as do all of my female clinicians here who've taken different journeys, but are massively involved in education. So for me, education is definitely the key to success.
Thank you. Thanks. Very, very nice to hear. And we always hear that. Well, it's your turn today to inspire the To Be Lights with your colleagues, your friends, your panelists this evening. So I'm going on silent, and it's over to you, Dr. Emma O'Connell, the ADI president, with this evening's Two Bills Live.
Thank you, Drew. Okay, so we're here to discuss how these great girls that are with me on the panel have carried out their journey into implant dentistry. And so first of all, I know that they all will hate me for this, but I'll introduce myself first so that people know what my background is. And then I'm going to go around the panelists and ask them each to give their story, a little bit about how they came to get to where they are, and just what their background is. So I'll start with myself. I'm from Northern Ireland, as you can probably tell by my very strong accent. I've lived now for 30 years in Scotland. I graduated from Edinburgh and I now own my own private dental practice in Edinburgh. And I started my implant journey in 2008 at the same time as also starting my digital journey with CEREC. So both of those things came together and now I do a lot of CEREC and implants and guided surgery. And then I got involved in the ADI at a much later stage. I'd always been going to the study clubs. I felt they were quite masculine, but I still really loved them. And I had lots of good friends there who encouraged me to take a step forward. In fact, one of the reasons I took a step forward for women was because my sister gave me a book called Lean In, which I encourage everybody to read, men and women, because it's all about how women should be taking a little step forward to help each other. And that's part of the reason why I'm here tonight. So I'd like to just go around the panel. I see Anna first, so she's next on the screen to me. So I'm going to get her to introduce herself and I will mute myself while she speaks. Thank you.
Thank you. I'm delighted to go first. So I'm quite new to implant dentistry. I'm my background, I graduated from Leeds in 2000 and then spent a few years in the hospital system doing max fax. And then moved to Birmingham in about 2003, 2004, and took up a post teaching oral surgery. I did that until I had my second baby, and met with a little bit of male dominance, if we could say that, in the field. And I felt that I wanted a better work-life balance, so I moved back into practice. At that time, I felt that I wasn't using my surgical skills, so I enrolled on an implant course when my children were very little. And that was about 6 years ago now. So I'm only 6 years into my journey, but it's allowed me a really lovely work-life balance where I can juggle a young family and be the best I can in implants. So I think that's me in a nutshell.
Just before you sign off, Anna, because I know you think you got away lightly there, I just want to clarify whereabouts you work in your implant practice at the moment, just so
okay.
That you know
so
where
I'm based just south of Birmingham. I work in two different practices. I don't own my own practice. I quite like leaving at 5 o'clock. So I work in two practices just south of Birmingham.
Thank you so much. So I'm going to move to Fazila next because she's next on my screen that I can see. So Fazila, can you just tell us a bit about yourself and how you came to be involved in implants in your role just now?
Okay, thank you. I'm delighted to be here as well with all the girls and with you. I qualified in the early 90s. I started my implant journey in 94 with Ashok Sethi. That was the first course that I did. Found it. I remember coming out of number 33 Harley Street and opening the door and thinking, that's what I'm going to do for the rest of my life. So it was really a pin drop moment for me. I originate from South America. I was born in the Caribbean. I came here when I was 12. I basically have been here ever since. And I started as a medical biochemist working in cell genetics in cancer research. Decided when I went to do my PhD that I wasn't going to talk about saliva for the rest of my life. So went into dentistry. Didn't look back. I was really lucky I could do it in 3 years. So it was shortened for me. And I qualified early 90s, did my first course with Ashok, and then did my max fax jobs for, again, very similar to Anna. I did 6 years of that up to registrar level. And then at that point, you have to kind of think, am I going to do medicine or not? Which I wasn't going to do. And, you know, it was a choice of do medicine or get married and have a family, which I wanted to do. So I did that. But I still, a bit like Anna, wanted to use my oral surgery skills. So I decided that if I couldn't work in an implant practice, then I'd create one. So I set about starting to do that from scratch. So I bought an NHS practice and turned it into a Harley Street practice. And I've been here 25 years. So I was very, very lucky. I then did, after my max fax jobs, I went and I did my MSc. I had 2 children during my MSc. I actually had my Viva the day after my son was born, which is quite interesting. Breastfeeding in the car and then going to your Viva, that's quite fun. And then after that, I went on and did my diploma at RCS with Ashok, and then really loved being part of education, and then got a tutor's job, a bit like my friend in the corner there, as she will tell you. So that's when I met Sinead, one of my lifelong friends. So we were tutoring together. I then went off to and did an associate professor job in NYU Stony Brook, and I only gave that up about a year ago. And then I did the lead tutor's job at RCS. So I've been in education quite a long time, nearly 20 years now. And I run my own courses as well. And actually, as you say, every day is a school day. I love the work, I love the patients, and I love what is possible. I love when you sit down with someone and they say to you, I don't know if anything's possible, and you're just desperate to say all these things are possible. So that's me. Thank you.
Thank you. And there we go. I learned something new tonight. I've known Faseela for a long time. I did not know she was a biochemist. How amazing. Thank you, Faseela. So I'm moving on now to Sandy, as she's next on my screen. So Sandy, thank you. If you can tell us a bit about yourself and how you've landed up where you are, where you've come from, etc.
Hi, Emma. I just want to say thanks for asking me to be a panelist. I feel really privileged that you asked for me to kind of explain a little bit about how I got to where I am now. Obviously, you can hear I'm Scottish. I qualified from Glasgow in 2002. I actually intercalated. I didn't think 5 years of a BDS degree was long enough, so I spent 7 and got a pathology degree at the same time, which I've never really used, but you know, it was 7 years at university. And I think that little bit of extra time at university was really good for me. I think that the dental career, you have to be a consummate professional. And I think that we ask a lot of young people to come out and be as professional as they have to be at quite a young age. So I think that benefited me a lot. I moved down to Manchester, possibly not for academic reasons. I'm gay, and I think Manchester had probably the best scene to live in at the time, but it was a great move. And I did my BT year in Manchester, and after my BT year I moved into Max Fax. I was Max Fax SHO in a general hospital in Wythenshawe. At that time we did cross cover for ear, nose and throat, which was quite interesting. I think that's been stopped now, but I learned an awful lot in that job. I left that job. I kind of wasn't sure what I wanted to do. I think the same as some of the other girls have said, I wasn't sure whether I really wanted to go back and do, you know, medicine. It's quite a big ask for someone to do a dental degree and then go and do a medical degree, but I always knew that I enjoyed surgery. So I moved into general practice and private practice in 2005. And my boss, who was a man, and I'll be forever grateful to him for this, he encouraged me to go into implant surgery. He said, I really don't know why you're not considering it. You need to get and do it. So I enrolled on the Royal College Implant Diploma, and I was really, really grateful to be given the opportunity to study in the Royal College. It was Ashok Sethi was running it at the time for a short time before that that ended, and there's some really great guys running it now. And I learned a lot, and I think, as Fazila said, I just felt that that's exactly where I need to be. I've found what I want to do. I've, you know, this is me. And at the moment, I work in practice. I do a bit of general work, but essentially what I do is I place and I restore my own implant restorations, and I enjoy it. And I enjoy what I do. I enjoy the practice. I'm considering potentially opening my own practice at some point in the future. And I really want it to be a place that people can come to, that I can help them and I can fulfill their expectations, and I can fulfill my desire to have a career that means something. It's really important.
Thank you, Sandy. That's lovely. I think that's one of the things that we want to touch on later, is just about helping patients and how you can, one of the things about doing implants is that you can really help to change people's lives, which is an amazing skill set to be able to have. But before we go on to that, we've still got two lovely guests to introduce. So I'm going to Sinead next. Thank you, Sinead. So if you'd like to tell us a bit about you and your journey, thank you.
Hi everybody, and thank you very much for having me on the panel also, Emer. Always a pleasure to be a part of it. As you girls probably have known me for quite some time, you all know that we have always been massively into the sort of pushing forwards with trying to get girls on board and mentor them and help them and show them it's an open book. We're there to help every single person. From my perspective, I started the second I qualified. I ended up in a VT practice, having qualified from Queen's University Belfast with a VT trainer who was one of the old grandfathers of implant dentistry, with, you know, no qualifications. They didn't exist in those days, of course. It was all trial and error, and everybody just sort of got on with it. So literally within 3 months of qualifying, at 23 years old, I had to not sleep for a whole night, go in and place an implant in a patient and just below their sinus, and literally just not have a clue what I was doing. It was sort of a piece of his fun, I think. He sort of threw me into everything in my first year, to the point that by the time the year was ended, I literally was afraid of nothing. So every mess up I made, he was there to bail me out. So the help that I got from, you know, him and his encouragement of me, I could never be more grateful for. So for 8 years, I was already on that pathway, I suppose, doing the typical faculty things, the MFGDP, following the career pathway. And it was only really properly whenever I had my third baby, I decided to move home to Enniskillen and open my own practice. And literally in the space of, you know, 12 weeks, I had a 4 or 2 and a 13-week-old baby, and I opened a practice. And then for some strange reason, I decided, right, I feel really exposed all of a sudden. I really know nothing. So I, at that stage, enrolled in the Royal College diploma, where I met Fazila. And from that point onwards, you know, the protocols and the routine and the regulation of everything just made me feel like a much happier and safer dentist in everything that I did from that moment onwards. I mean, it's been pretty much a journey since that. There's not been a course or, you know, an exciting thing that I've seen come up that I haven't wanted to go and learn more about. It's been a huge journey in terms of the growth and the leadership that you have to give, also bringing people on. You also know that I've got 3 brothers who do exactly the same job as me. So there's an element of, you know, did you do that? Well, I have to do it as well. Slightly competitive scenario going on between the 4 of us, and always, well, I suppose in the back of my head, I'm always thinking, if my brother saw that job I just did, I would be mortified. So it's always the seeking of absolute excellence that I'm always sort of going for. And I think if that dies in me, that's the day I should retire. So then Fazila and I, we ended up doing college tutoring after that, which was a really fantastic thing. That, I suppose, that ignited the whole teaching end of things for me. And I just loved, you know, helping people along. And just, I mean, it's just that satisfaction that you get that you're doing something so safe and so predictable. And ultimately the fear goes. I mean, I don't look at my diary and go, oh gosh, that's in today, because it's literally been a lifelong plan to learn the next thing and the next thing till you know that you're properly competent at it. And even still, I still think I'm rubbish, but that's as I say, that's the sort of territory that I walk on every single day. So yeah, it's fantastic. So the practice is 18 years old this week, around the next couple of weeks, and yeah, it's almost an adult. I'm just not sure I am yet. I think I still need to keep going.
Thank you, Sinead. So we move to our last panelist, Susan, who is I've known since I was at school, in actual fact. So she's the person I've known on the panel for the longest time. So I'll let her tell her story and how she got into implants as well. Thanks, Susan.
Thank you, Emer, and thank you for the invite onto this panel tonight. Yes, as Emer said, we've known each other a long, long time. We'll not discuss how long, but we also went through university together, just 1 year apart. But formed a very close friendship at that point, and it's stayed true all these years. So I graduated from Edinburgh in 1993, did my vocational training in Scotland, and then returned back to Northern Ireland after that year's vocational training. Joined a general practice with a guy who was very motivated in postgraduate education. He was involved in our postgraduate deanery, and he really encouraged me to get on in education and stuff, and did my MGDF. Had 3 children, bought over the practice, so half a practice from him, so was sharing the business with him, had ticked all of those boxes and thought, I quite fancy doing something else now. You know, I was in a general dental practice. I'd started doing vocational training, and I was a trainer, and decided I would do an implant course, and I did that back 18 years ago in 2003. And since then, just like everybody else, although I have not done a faculty diploma or anything, I'm very involved with FGDP through MFGDP and MJDF, and now onwards through to the new College of General Dentistry, and I'm currently Vice Dean of FGDP. So very much into my education, that's for sure. Know Sinead a long time through old time study clubs in Belfast, and I know Sandy just from reputation. Fasila I know from FGDP days, and Anna's a new colleague. So it's really lovely to be here. So my implant journey has been very much based in my own practice, treating the patients that just were within the 4 walls. I do take some referrals, but not a huge amount. I'm quite happy just pottering away at my patient base, and it's a big practice now. We've got 4 surgeries, and there's plenty of in-house referrals. And I still would then, if it's outside of my comfort zone, I just send it to some of my colleagues, all who have been great mentors to me. And I think I probably hopefully know my own competency, and I'm happy to refer on what I'm not happy to do. And I suppose that's important just for your own, as you say, your confidence and your competence, but you don't want to be lying awake at night worrying about something that you're not happy with. So, but yeah, so that's all really. I'm still in practice. I was sole principal after my partner retired, but I recently, 4 years ago now, became part of corporate. So I can go home at 5 o'clock and leave it all behind. And so that's all good, and it's a new, better work-life balance for me now, not having to do all the other things associated with running the practice. Although I'm still clinical lead in the practice and regional lead in Northern Ireland, so I haven't really stepped that far back, but I've tried a wee tiny bit. And that's all. Thank you, Emer. Over to you.
Yeah, so for a minute there, she was making me jealous, thinking she had the perfect work-life balance, but then I realized, nah, she doesn't really.
No, I've replaced it with something else.
So one of the things that we want to kind of get across to all colleagues, so this is not just about encouraging our female younger colleagues to get involved in implant dentistry, it's about encouraging every gender. We want diversity, we want every kind of person that wants to be involved in implant dentistry to do it, and to try and do it in a way that is safe and effective for them. Because I think one of the things that we recognize is that there can be barriers to when you get your education, and then perhaps becoming more risk averse as you progress into being embedded in a practice. And I guess I want to ask the girls if they thought that there were certain parts of their training that they should get, or that one should get at the earliest possible stage to help somebody to be able to get involved in implant dentistry in a more maybe successful way, or an easier way, because we all know there's plenty of people that do courses in implant dentistry and then actually they only place a few implants and then give up because they just feel too out of their comfort zone. So I guess that was one of the things that we've been talking about behind the scenes before tonight. So I'm going to just go around everybody, and I'll just go around in the same order because it's just easier. So we'll just go back to Anna with that question. Thanks, Anna.
Hello. Part of my background, and a big part of my background, is oral surgery, and I taught oral surgery for the best part of 10 years. And during those 10 years, I found the experience that undergraduates are coming out of dentistry with vastly changed. And new graduates nowadays seem to be have a lot less experience in oral surgery and flap surgery and even just extractions. In order to become a good implant dentist, or in order to become a good overall dentist, you need to have experience and confidence in these, slightly more tricky surgical procedures. And if you're not confident in taking out a tooth, then you're not going to be confident placing an implant. And that's my personal opinion, but I do think that's an opinion that we share. So my advice, if you are interested in broadening your horizons and you're considering looking at implant dentistry, would be to start in your own practices, taking out those teeth that you think, oh, should I refer it? Shouldn't I? Start taking them out. Start raising a flap if you break it. Get yourself on a basic surgical course with pig's heads and suturing techniques. And I really do feel that there may be there's so many implant courses out there, but if you go in green without any surgical experience, it will frighten you. Whereas if you get the basic skills right early on, then you can move into some more difficult techniques and implants later on, and I think you'll be more successful.
Thanks, Anna. Faseela, any words of wisdom from you? I mean, I think we pretty much all agree that you need to be able to take out teeth to place an implant, because it's pretty much.
Yeah, I agree 100% with what Anna said, but I think I come from a slightly different side of it. I think we take out teeth without thinking about what's going to happen after that. And I think we need to be thinking about what's going to go into that space before we take out the teeth. For me, that's really fundamental. Whether it's a bridge, whether it's an implant, whether it's a socket preservation, whatever it is, I think we need to think about what's going to happen to the space, what's going to happen to the bone, because it's going to disappear if you don't think about it before you take it out. And if you are planning to do something with it, then maybe think about the technique that you might want to use to take that tooth out, and whether or not you want to look at that bone and look at that soft tissue before you trash it all or send it to someone else to trash it for you. But I think we need to think about it well before. And I'm not talking about the person who comes in with a fractured tooth and you've just got to do it. I think there are lots of times where people say to someone, well, you've got to lose that tooth, but that's the beginning and the end of the story. And I think we need to be thinking about what happens after that to that person. Because quite often people have the tooth out and then we forget about them. So that would be my advice. Have the conversation before you lose the tooth. Think about what the options might be, and then be really, really careful when you take that tooth out, and think about what happens to the socket before you take it out and what you might do with it.
Yeah, so I guess you're really saying that we need to be responsible for educating our patients as well as ourselves, because if the patient doesn't understand the implications of losing the tooth and what the sequelae of that may be, then they may think, oh, I could just get the tooth out, it's no big deal. But actually, if they understood perhaps the long-term implications of that, they might think twice about it. So I think, yeah, you're right, that's really important. Sandy, have you got anything to add to that?
I absolutely agree with both what Anna and Faseela have said, but I actually also think that we need a distinct implantology pathway for any young graduates, be it female or male. I feel that orthodontics, endodontics, perio, there are really well-defined pathways, but for some historical reason, implantology, which is arguably, and this is probably controversial, but arguably one of the most, if not the most complex area in dentistry to work in general practice, we don't have a set pathway. That, you know, we need to come together and make a pathway that younger clinicians can get on, so that they have a kind of a road forward in their career that they can look to without having to necessarily think for themselves what they're going to do and find courses that may or may not be suitable, you know, off their own bat. I think that's really, really important. And it comes from above, it comes from on top, and it's us and people like us who have to start to kind of make that pathway happen.
Yeah, so I guess we haven't really had that conversation, but because I think there's a lot of vested interest in the teaching of implantology, and then also it transcends different faculties in terms of the specialties. So it's perio, it's restorative and oral surgery. So there's a lot of competing potentially professors that might have to be brought together to agree a pathway, but I couldn't agree with you more, and that's a great point. Fazila, anything you'd like to add to that?
I think that's a fantastic idea. I think.
Sorry,
you know,
sorry, Fazila, I meant to go to Sinead. Sorry.
I was going to say.
Sorry.
I still think that's a great idea.
Sorry about that. Sorry, Sinead.
Yeah, well, from my perspective, I mean, undergraduate training of any description, you know, I mean, it was relatively good in my day, but I know in more recent times, the experience of any of the graduates coming out, I mean, there's barely an extraction, you know, even a root canal done on any form of numbers. So I think unless you get your feet wet, if you like, very, very quickly after coming out, all that ends up happening is that your confidence literally falls apart. Very, very quickly. So unless they can get in and, you know, find a mentor, somebody who can even guide them, they need to be enrolling in something that involves, you know, sockets, blood, extractions, and even be observing somebody who, you know, has sort of is open to sharing all of that information with them. And I mean early on, very early on. I sometimes think if you wait for 5 years, I mean, I have colleagues who came out, didn't do an endo after 1 year, and then referred everything ever since that. You know, I've got my brother who does oral surgery. Some of the extractions he gets in are just crazily easy extractions, and yet there is some fear factor that is there that comes straight back from those undergraduate days. And those simplistic things, just even coming in and observing somebody, even if you're not sure yet, but just simply being open to being mentored from a very early stage before that fright sort of sets in. Because I think what you don't do in your first year, you're very reluctant to do it ever again. So you find yourself in a trap, just doing simple general type dentistry. And, you know, that to me is the least rewarding part of dentistry in any form.
Yeah.
Often very thankless.
Yeah, I think I really 100% agree with you that we become less, we become more risk averse as we get older. And I think the younger colleagues nowadays are really worried about litigation, and they're worried about, you know, comprehensive note taking and lots of other things that have taken them away from being a wet fingered dentist. Susan, have you anything you would like to add to that?
Yeah, I mean, I do agree with everybody's points, and great point, Sandy, about a career pathway and a sort of roadmap for people coming out. The thing is, and I know, Emer, you talked about this, getting recognition from the GDC for implantology or implants in dentistry. And that's probably a good way to move this all forward, and then something could be established. As far as training is concerned, I've been involved in vocational training in Northern Ireland for way too long, both as a trainer and a sort of an admin role. I used to chair CVT, and I'm still a member of the committee in Northern Ireland that they don't have across the UK anymore. But there's been lots of changes in the training of undergraduates, which has pushed on a lot of the practical side into the practice the first year out. And quite frankly, you're right, Sinead, a lot of them, if they haven't got exposed to it in that first year, they're never going to actually be able to jump off the cliff and do it. And that probably comes down to who you're exposed to as a trainer. certainly locally, they have tried to address the oral surgery issue by giving them extra training at a local oral surgery high street practice, and that's helped a lot to just get wet-fingered oral surgery experience, because the cases maybe aren't always there within their practice, or they're just not prepared to do it, or the trainer's a bit worried about them doing it. As far as who talked about taking teeth out and preserved facility, you said about that. So if I'm placing an implant, I really would prefer to take the teeth out myself, if at all possible, because at least I can see what it was like beforehand, if there was infection, if there was a soft tissue defect, if there was, what the socket's like when you take it out, if it was difficult to take out and I've destroyed some of the bone, you know, just different factors, how the patient is healed afterwards, all of those things then factor into what's going to go down the line. And I suppose when you're in, where I'm looking with that respect, is I'm in a practice, I'm maybe taking referrals from the other dentists, but the patients are there and I am able to do that. It's not like I'm picking up a patient that's just arrived off the, you know, of a slow boat to China, and I don't know what they're like. So yeah, everybody's had really great points so far.
Okay, so yeah, what do you still love most about your job, and why would you so strongly encourage your younger colleagues to get involved in this wonderful aspect of dentistry? Anna, I'm going to you. I'll get the names right, sorry about that.
What do I enjoy most about my job? I like I said before, I'm a general dentist. I do take some referrals, and I run an oral surgery tier 2 clinic all over Warwickshire as well. I love meeting new people. I love seeing, particularly the oral surgery patients that are referred to me are often from practices that don't do implants, and I think you can get quite blinkered if you don't do implants. Then you don't tend to talk about them quite so much. And I think it's a good tip for younger colleagues, maybe, you know, in their first few years, is just because you don't do implants yet, you must speak to the patients and offer them these things. And the more you do that, the more normal it will become. But, you know, meeting these patients that don't know much about it, and you know, they're often devastated to lose teeth, and to be able to say, well, actually, no, hold on a minute, we can do something for you, and we can fix that. And just making nervous patients who feel that they're really losing part of them, to be able to say, no, we can sort that, and taking them through the journey of having an implant and coming through the other end happy with a smile. And that's what I love about it. And I also love the fact that I don't have to work full time. I know it sounds really crass to talk about finances, but I can work 2 or 3 days a week providing implants and surgery for people. And that gives me a lovely income in order to be able to spend the rest of the time with my family. And I'd just like to say at this point, you know, for you know, younger female or male colleagues, you know, that don't have children yet, it is something that you can add to your practice, which will contribute to a lovely work-life balance in the future.
That's a great point. I agree 100% with you, so that's also good. Fasila, your point about what you love still about your job?
I work with 8 young people, all male, and they are all very good. They've chosen to be very good at cosmetics or ortho or whatever. So we're a very multidisciplinary team, but they all do implant work. So we operate together. I virtually never operate alone. So for me, it's everything that Anna said about the patient. It's about looking at a patient and enabling them to go from where they are to where they want to be. And that is such a special privilege to be part of. And you know, it's the thing where you hold the mirror up and they suddenly realize that they've got back who they were. And you know, that sense of self has been not fully lost. And that is something that you feel very humbled to witness every single day. And I'm very lucky I can do implant work every single day. But actually my other joy is watching my young colleagues get their implants in, the first one, the 10th one, to do a soft tissue graft, and they come and they show me every single one. And to see them start to grow up the way we did, and to be able to hold their hands when they run into trouble. And I think that is one of my big joys.
Fantastic. Thank you, Fasila. Sandy?
Hi, I think the girls have kind of intimated a lot of the feelings that I have regarding why I love my job. I think there's a couple of things that I wanted to say about, certainly as a female, I think the career in dentistry is probably very unique, because I think that we are given an opportunity to be on a par financially with men. I feel that we can work and earn, and it as a career choice, I think, second to none really for a female. But I think the most important thing for me, and what I absolutely love, and when I think about doing my job, is when I go into my surgery and I treat people and there's laughter and I have patients who are happy. And some patients come in and they're really, really, they can sometimes be a little bit abrupt, and it's usually, it comes from a place of nerves. But I think when you build a relationship with a patient and you help them to realize what they want to achieve dentally, but also you get to know them as a person, it's a really important thing. And those patients never leave you. They continue to stay with you, and they become, it sounds a bit cliched, but kind of they become like friends. You know their life and you share it with them, and they come in and they speak to you person to person. And I absolutely love that. And every practice I've ever worked in, people will always say there's so much laughter comes out of Sandy's surgery, and that's what I want. That's how I want it to be. That is so important.
Sandy, I want to come and work in your practice.
It's all fun until it's not.
Oh, I know that. Okay, Sinead, for you?
Well, I have to say I completely concur with Sandy's comments, because I think everybody's journey is very, very special. But the second that you get that ching of, I get this person and they get me, it's that realization that the rapport has just arrived, and this is going to be a fantastic journey. And you almost know this within 5 or 10 minutes. And you can see the hope in their eyes. You can see them changing as the thing moves along. And because we're so able to show them everything digitally these days, they can see the end result before they begin, and they almost cannot even take it on board that you could possibly create this solution for them. So I just think that, that's just that, as you say, Sandy, it's constant laughter, banter in my place. It's just crazy. And there's all sorts of, and the funny thing is they're all different. So it's that lovely journey with each personality that you come across. I think it helps that I like to have fun most of the time anyway. So I think that's sort of half the battle. If it proves to be hard work, I send it somewhere else. But I think that's sort of the huge nugget for me. I go home thinking every day about, oh my God, that was just a wonderful day. So
it's a common theme amongst us all about rapport building with our patients, which is great. Susan, what do you love most about your job? Apart from the fact that you now have to work a lot less.
Well, I wish. I know you'd think that I could work a lot less, but suddenly I just seem to be working all the time. Anyway, that's obviously because I do love my job, and I suppose that's a good thing. And I do absolutely love it. I have sold the practice. I couldn't see myself retiring at any point in time, apart from the fact I have 3 kids at university, and they don't get any cheaper. But dentistry is, as you said, Anna, it does give you a very stable financial cushion. So that's a great thing. I love working where I work. I love the team I work with. Like you all, we have good fun. There's not every day is a good day. Everybody has bad days, but every morning I go in, even if you've been off for a week, you think, oh, will I go in today? Or how will it be? And you get back in and you think, oh God, I really like that. I really like a good endo. I don't mind the odd denture, but I do like the implant work, and my nurse loves it. So she would do it day in, day out if we could do it all the time. And it's just a nice way have a good mix, whether you're doing it all the time or dipping in and out. I love the fact for dentistry is very much more autonomous than medicine. You know, we are in control of our destiny. We're in control of what education we choose to do. We're in control of what patients we choose to see, what treatments we decide to do. And that's a very nice position to be in. You're not given a patient and said, right, you have to do that. You know, you do have a choice. And it's just, I don't know, it's a great job. I mean, I have 3 kids. 2 have chosen to do medicine, but the youngest have chosen to do dentistry, and I just love it. And she seems to love it, and I can't wait to kind of be there, bring her through it a bit more when she's through the doors. But yeah, it's a very different landscape to it was when we all qualified zillions of years ago for some of us, but not so much for 2 of our younger panel members.
Yeah, I think that's one of the things, if you heard Sinead's story, which was basically you got out there and you got on with it and you just basically tried it out. And as long as you had someone though in the background, and I think that's one of the most important things that I would say for people is the whole issue of mentoring. It's something that we're currently working on at the ADI at the moment in conjunction with the FGEP, or the new College of General Dentistry, to try and work out a pathway for at least that part of the support network that is required to help a young clinician, or not even a young clinician, but a clinician on that journey into safely and effectively placing implants. And so I think probably a lot of the people around this panel would be willing to help other colleagues in their journey and help to mentor them. I just wonder if you girls have any ideas about how we could facilitate that in a more kind of structured way that makes it easier for people to understand both the responsibility of the mentee and the mentor. And there's a lot of issues around it, and it makes it kind of difficult because, as we know, some people are more receptive to being taught than others, and some people are more open to positive feedback, or let's say criticism, and those are things that you have to be open to if you want to learn. You have to be reflective of your own abilities, and you have to also then be reflective if you're going to help someone else along the pathway. So I just wonder if you could give any little nuggets about mentoring and what you all think of that as helping people on their journey. And I'm just going to start again with Anna. Thanks.
My feeling is we should try and get a database of mentors where and invite people to sign up to that database. I do think there is, dare I say it, an alpha male or female, you know, that are the people that do tend, there's a lot of mentors that are very sort of, this is what I can do, and they're not necessarily the people that you want to bring you on. I really liked what Sinead said earlier about just finding someone that, you know, not necessarily to mentor, just go and you know, go into their practice, see how they work. And I'd certainly be, you know, very happy for anyone to contact me for that. With regards to mentoring, you know, setting up a mentoring database, I think that's something that we all should work towards. You're the you know, the president, and I'm sure you have much better ideas than I do. But I do think it's really important that we get the right people on there, and people that do want to nurture rather than to, dare I say it, show their own skills.
A good point, I think. But yeah, I think what Sinead and you've both said about trying to encourage younger clinicians to come and watch what other clinicians do. I think we're not very good at that in dentistry, about being open and about letting people, I mean, I know at this COVID crisis, it's not exactly easy to allow people to come to your practice, but traditionally we've been quite closed and quite kind of non-inclusive. And I think, Fazila, you've probably got the most experience of teaching within your own framework, within your own practice. And maybe you could share some thoughts about that with us. Thanks.
Yeah, I do agree about the mentoring. I think, you know, take one step back. You know, if you don't know anyone in implant dentistry, for example, and you're interested, there is so much going on with social media, for you to make connections. But also you could go to a study club in your local area, meet someone there, and, you know, just get every opportunity to go and look at as many different people as you can, because you would be surprised where the nuggets are, I think, as Anna was saying. The other thing about the mentoring list is that a mentor is a mentor is a mentor, a bit like chocolate, right? They're all they look the same, but they're not. And I think it's really important that the people who are supposed to be showing you something have some standardization in there, and that they're using predictable, evidence-based protocols in the way they work, rather than going to learn. I mean, I think any observation is helpful, but if you're actually trying to emulate this and put it into your own work, I think you want to go to people who have a standardized training, who you're going to learn safe, as Sinead was saying, competent skills that actually make you confident, rather than, you know, Joe Bloggs does this, so I'm going to do that.
Sorry, I'm on mute.
I think Susan just put her hand up, so I stopped talking.
Oh, sorry. Susan?
No, I was just going to say, you know, I mean, Emer mentioned it, and the ADI and FGDP and CG Dent are, you know, are working on these mentoring guidelines, and that's very, very much what we're looking at, is being able to indicate what is the categories that you should have to be a good mentor, and what you know, what's the right word?
Expectations of
both the mentee and the mentor, so that people have something to look at and actually benchmark them, you know, so that it's not just, you know, written on the back of a fag packet and, you know, away you go and do that. You know, it's not a see one, teach one type of scenario, you know. Yeah, so I mean that's hopefully coming, it's all in hand as such. But yeah, these things need to be documented correctly, so people aren't throwing money at the wrong things and doing the wrong training and end up running down a really, really dark rabbit hole where they get into trouble.
I mean, we have to remember that implant dentistry is actually relatively new in terms of the overall length of time dentistry has been around on the planet. So it's still an emerging field, and we're still trying to work out best practices, and we're trying to learn potentially from other countries to see how we can better emulate the good things that they do and bring it back to the UK, so that we can more safely and more effectively get more people involved in implant dentistry. Because remember, 50% of our population don't even go to the dentist. So there's plenty of work out there for dentists, but it's about raising the IQ of the patients. So I think we need to raise their tooth IQ so that they understand. We talk about the dental IQ of our patients, and we now have patients coming to us asking us, as soon as we say they need a tooth out, they'll say, I want an implant, because they understand what it means to lose a tooth in terms of bone loss, etc., because they're kind of already higher up that spectrum. So that's something that I think every dentist can start to encourage the patients to learn more about their own investment in their own oral health. Sandy, over to you now.
Hi, Emer. I actually wanted to read a quote that I found the other day that I think is really relevant on this point. And it reads, "When you get to where you're going, turn around and help her too. For there was a time not long ago when she was you." And I think that we could all, male and female, just take ourselves back and have a little think about, you know, when we started out and how difficult it was. It's easy for us to forget how hard it was to get opportunity, to get mentoring. And I think we get kind of stuck in our own cycle where, you know, if you're running a practice, you're an implantologist, it's really busy, it's complex. You kind of forget how you got there. And it's just really important that we take the kind of leadership and pull the younger generation up with us, because there's a lot of older implant surgeons who are going to find that there's literally no one there to replace them. If the older surgeons don't start to kind of bring newer people in and mentor them up to replace them, we're going to have a big problem.
Yeah, I absolutely agree, because there's a lot of our younger population who are risk averse, partly because they haven't had the same amount of clinical training as we got when we were undergraduates, and partly because of the whole litigation in the UK. So these are really amazing points. Sinead, you're the last one to comment, so I'd like you to say something now about mentoring.
I think, you know, there's a huge disparity between the young fresh dentists coming out who are so incredibly digitally and socially aware versus the people who have got the hands-on experience and the many thousands of procedures under their belt. And there's somewhere in the middle that the twain should be meeting, you know, where the information is completely shared. I mean, it's something to go, oh yes, I've planned that all and I'm going to just do a guided surgery, and sure, like, it's all planned on a computer. But the fact of the matter is, unless you have got proper surgical training and something happens and you don't have plan B in place and you don't know how to backtrack out of that problem, well, the whole thing may as well just be thrown out. The patient could be bleeding, there could be any amount of additional things going. So there has to be that element of mentoring somewhere in the middle that allows people to do these things completely safely. It doesn't matter how fantastic your surgical guide was if you can't screw it on, or you didn't know how to raise a flap in the first place. So, and then of course, whoever taught a person how to suture correctly, because almost more importantly at the end of everything is the suturing technique. So that's what makes a patient heal well. Otherwise, you've got failed bone grafts, you've got failed everything. It's just, you know, you need to go back to brass tacks and learn from the start. Create your pound sterling and the thousands will look after themselves. So yeah, pretty much go back, learn the protocol, start at the very beginning and get good at every small piece in of the building blocks that make the building. So
thank you, Sinead. That just reminded me that my granny was a dressmaker and taught me how to sew. So she taught me well. Now, Susan, you did discuss with us about the whole issue with succession planning, which also leads into mentoring, and about the fact that there's lots of really big implant practices in the UK that have been bought by the company you work with, Portman, and that they may have a problem come 5 to 10 years time when all these older clinicians who've got vast experience, vast wealth of knowledge, decide that they're going to leave if they haven't indeed helped to nurture and help younger clinicians to come on and learn those skill sets that they are so familiar with. So I agree with all the points made by the girls, but you did say that you thought there might be an issue with that, and I'd just like you to elaborate on that if you don't mind.
No, I mean, we have succession planning meetings, because no matter what specialty you're in, even if it's just a general practice, you do need to have some plan to exit. And, you know, anybody who's trying even to sell a practice needs to identify somebody who could potentially take on their mantle. And so that's where the mentoring thing would come in very nicely. If they identify somebody even in or out of their practice that has the right skill set, or that can have the skill set developed. And then, as Sandy said, you know, you're not going to have a huge hole left when a lot of experienced practitioners retire, and there's nobody necessarily to take on over them. And there's a lot of practitioners not buying practices anymore. You know, I mean, I have sold to a corporate, and you know, it's slightly different. And then there's maybe not the same drive for that younger associate within a corporate group to maybe necessarily want to see themselves at the lead of that practice. But certainly that's what we're trying to develop, where, you know, they will have practice clinical leads that aren't necessarily the ex-vendors of the practice, and those dentists will be the lead of that practice. But again, they'll help to mentor on down through, you know, cascade on down through the associate levels. But for anybody who's of a certain vintage, it's certainly something they need to consider. And it's very difficult if you're a referral practice, because people refer to you, and because you are you, and you may end up finding that there's nothing there for you to sell on. But if you have somebody an underling that you're bringing forward and mentoring and teaching, that person then can be introduced to all of your referrers, can see all of your patients, and then ultimately can step into your shoes, and you can sail off into the sunset.
Oh, for that day. Okay, so girls, we're just about at the end of our hour here. It's passed very swiftly. But if you have any other little nuggets, I think the thing that I would like to say is I would like there to stop being such a fear factor for young clinicians. We I was at a vintage, and I think probably Susan, Fazila, and Sinead definitely all were at that stage where we just got stuck in. I did an oral surgery job and was just left to do apicectomies and take out wisdom teeth on the second day of graduation, by the way. So now there was a registrar sitting in the next room who could come and help me, but she was doing the Times crossword and did not want to be disturbed. So it was just very much like, don't go and bother her unless you absolutely have somebody who you've accidentally started bleeding, or, you know, there's a big problem. So I think we need to kind of reverse time a little bit in some of those aspects of allowing our younger clinicians to not be so fearful of things going wrong. And perhaps that's up to us as the kind of older generation now within dentistry, much as it pains me to say that, to try and help our younger colleagues to get involved, to come to visit us, to see us, how we work, and hopefully to maybe let them start doing some work that is outside their comfort zone, but knowing that there's an experienced clinician there to help them should the Times crossword become too hard. Anyway, before we wrap up, girls, just a last few words from each of you. I'll just start with Anna again, and then we will go round everybody.
Thank you. I agree with what you said about, you know, bringing on and what everyone said, particularly what the quote that Sandy said about, you know, turning around and helping our younger colleagues. And I absolutely put myself in, you know, the next. Sorry. I absolutely see. I can't. I'm definitely next generation. I'm rubbish at technology. My children roll their eyes. What I wanted to say is really all this social media. There just seems to be so much division in dentistry. Whether you're male, you're female, you're, you know, black, white, yellow, brown, you know, there does seem to be an awful lot of division in dentistry. And when it comes down to it, we're all here for the same reason, and that is to provide quality treatment for our patients. And if we all work together and celebrate, you know, what we're all good at, then I think we'd just be a much more nicer profession to be part of.
Yeah, I think we did kind of touch on this as maybe one of the reasons why dentistry is quite divided is right from the get-go, it is a competitive degree. It's competitive to get into it, and then once you're in it, there's often quite a lot of competitiveness within the kind of clinical training, etc. And maybe we need to move away from that model and make it less adversity and more about like collaboration. Fazila, any points from you?
I think I do really agree with most of what's been said, but I think if you're going to do any learning, any training, any watching, and you want to develop and you don't know where to start, our motto in the practice is be brilliant at the basics, just like what a lot of people said today. If you can cut a flap, take out a tooth cleanly, do the endo, whatever it is, and just be really brilliant at the basics, then you've got great foundations to lay things on top. And when you see someone else do something really cool, celebrate, because we don't look at our colleagues and say, and instead of feeling bad that you can't do it, why don't you just feel joy that they can? Because that's a start.
Absolutely. Sandy?
I think really for the younger colleagues out there that will be listening to this, I hope are listening to this, self-doubt and a little bit of fear is actually great, and harness that, but don't allow yourself to go over the other side of the bell curve and stop yourself from doing what you could very well do if you just harnessed your fear, got on the saddle and got on with it. Really, that's it. Don't let fear stop you.
Yeah, I think one of the things that we identified was that often we got a tap on the shoulder from someone to push us a little bit forward at just the right moment in time. And that is something that I would like, I think all of the girls here tonight definitely would want to do that for any of their colleagues and say, if you want to do it, we will help to facilitate that. And we want to give you the little nudge that you might need just to take a step forward and not feel the fear, or feel the fear and do it anyway. Sinead?
I think sort of similarly to what you just said, feel the fear and do it anyway. I mean, I had said a few times about when you are young, inexperienced, and think that your voice isn't worth hearing, and you really, really want to ask questions, but yet you feel like you are in a room full of, and in implant dentistry, unquestionably, there's probably, you know, in our day when we were learning, it was 90% males, and you know, actually most days it still is in conference halls. But I always had this incredible fear of asking even the most basic or simple of questions, because I was too embarrassed that I was just simply not good enough. And sort of what came from that was just this need to know more and more and more to ensure that I never felt that insecurity again. And I think that's an incredibly important thing, never to feel you can achieve anything you set your mind out to. And I think females particularly tend to go about it in a much more logical, contrived way to make sure they safely move forwards and get that knowledge base behind them. So just always remember that you will get there and you will achieve it, and don't be afraid to, you know, let your voice be heard.
And I think also one of the things is that, you know, we all have made mistakes, we've all made errors. And I think one thing that my dad, who is a builder, who's not anything to do with dentistry, but he said to me, a mistake is only a mistake if you keep repeating it. And I think that's one of the things that stuck with me a long time, was that if I do make a mistake, I want to evaluate that and then try not to make that mistake again, because to repeatedly make a mistake is just, well, stupid and careless. So it's really important to try and learn from your mistakes. Don't get downhearted and don't give up, but just try to learn from it. Susan, final words from you?
Somebody just pushed open the door, but it was my puppy. Yes, I think identify what it is you want to do and where you think you need more training, and then, you know, find somebody who's prepared to do that with you, and surround yourself with the people that are going to give you the positive energies and also the help that you need, but also the right tap on the shoulders, you say, Emer, if it's not going well. And don't beat yourself up about the mistakes, because, as you say, everybody makes them, and it is the only way to learn. You know, I still put my first incision in and look at it and go, that wasn't the right place. You know, and that's after 18 years, you know, and I think about it beforehand, I still get it wrong. Not all the time, hopefully, but you know, you can then start to identify where you just have not got it 100% right. But every day is a learning day, no matter how long you've been doing it, how many you've placed. ADI is very good, and their forum's very good at clinicians who are in the upper levels of all the echelons. They're quite prepared to talk about their mistakes and the things that have gone wrong, and that's very important, and it's very important for everybody to accept that, you know, it's all about education. It's all about admitting that things aren't 100% right all the time, and it's about grasping that fearlessness when you're young and starting out, and just and taking it forward.
Yeah, and I think one of the things I've learned in my own practice is that if I have made a mistake, is to come clean with the patient and then try and rectify it for them, if it's within my competency, of course, and if it's not, then have the wit to send it to someone else who can fix it for them and not charge them extra money for that. We do have a couple of questions just to get answered, which one of them are there any specific implant courses you would recommend for a new starter? My personal thing would be to do a restorative implant training course, first of all, just to learn about abutments and torques and all of the different words that are associated with implants. That it's a new lingo. It's kind of like learning anatomy. There's a whole new lingo out there, and if you get au fait with that, that helps you. And I would say start with the basics, which is restorative, and there's many of those, and that'll give you an idea if you even like dealing with implants, and then go on from there. Any of you girls like to add anything to that? Yes, Andy?
I think definitely get yourself on a basic oral surgery course. You know, it won't cost you the earth, but you'll realise quite quickly whether you actually do want to do something surgical before you basically waste 20,000 plus on an implant course. Because I think, you know, the one thing that people don't realise when they get into implantology is exactly how much it costs to train. So you can quite easily do some basic courses as Emer said, in implant restoration and some very basic oral surgery, which will really give you a good idea as to whether that's something that you then want to go and spend your time and money on.
Yeah, because I think the worst thing is to get in and do something, spend a whole lot of money on it, and then never be able to actually utilize those skill sets. I mean, that's just, I've lived in Scotland too long. There's no danger of me ever doing that. I don't know if everybody knows how tight the people in Scotland are, supposedly. They're really not. Anyway, we are just about reaching a close. I don't know if Drew wants to pop back on and say goodnight to everybody. I think he's there. But thank you, panelists, for joining me tonight. It's been a great conversation. Sinead and I are off to the pub now, so we're very excited. And thank you very much, girls, for all of your support throughout the last through the pandemic and over the last few years. It's been wonderful. And thank you, Drew.
Thank you. And that was a great session of really discussing so many different ideas, thoughts, and ways we can move forward. I think you spoke about feel the fear and do it anyway, sitting right in front of me, which is so good. And every Tubules Live, I recommend a book. Well, this time I don't have to. I think in terms of implant courses, what you said, getting mentors is so important. And working through that. One of the things I like to put here, as you said, amplifying the female voice in implant dentistry, there is something worth thinking about here. Is that do you create a female implant dentistry mentor network? Because that would create comfort for so many females who don't know where to go and who to speak to in terms of people who understand them.
That is definitely something that we are thinking about doing at the ADI. We're particularly thinking about having a sort of subcommittee within the ADI to promote the ADI membership, because we don't have that many members percentage-wise that are female. So we'd really like to change that dynamic within the context of just being part of the ADI, but just to have more women join us. And the more women that join, then the kind of easier it becomes, and hopefully we all learn from each other and drive forward and help our younger colleagues. But yeah, I would like to think that we can have some female mentors on that program going forward, because they're really, there are two here, obviously. Sinead and Fazila have been doing their stuff with the Royal College and then in their own courses, but it is something I think that we do need to make more of. You're right, Drew, thank you.
No, that's something worth thinking about, but well done to all of you. I can understand that balancing everything and taking the journey you've all taken is basically admirable, respectable, and inspiring. And I hope it is for so many people. I'm sure the audience, Jacqueline Davidson says, awesome girls, well done. Irene says, well done. Jamie Nee was on there as well, and she really agrees with a lot of things you've said. And for the younger graduates and younger dental professionals, reach out, speak to them, and please don't sit there thinking it's not possible. My sister was in a wheelchair. She had muscular dystrophy, and she, at the age of 30, having had a lot of what we say discrimination in the country we grew up, she said one thing: it's not impossible. The word is I am possible. So getting over the failure and over the feedback and over the fear, find an I am possible. And I hope that the journeys of today's panelists have made that possible for all of you. Thank you, Emer, for hosting this. Thank you, Sandy. Thank you, Fazila. Thank you, Sinead. Thank you, Susan. And thank you, Anna, for sparing your evenings. Keep going, keep inspiring. Tubules Live back on Monday evening with biomimetic dentistry, I think it is. But for this evening, it's a goodbye from me. It's goodbye from Emer. Goodbye from Anna, Susan, Fazila, Sandy, and Sinead. I hope you've all got something from it. Have a great evening. Thank you.
Thank you.